This lecture will go over Chapter 17, Stimulants. When we say stimulants, we're talking about CNS stimulants, meaning brain and spinal cord, approved to be used to treat ADHD, narcolepsy, and the reversal of respiratory distress. We'll also talk about stimulants being used as anorexiants, used to suppress appetite. Categories we're going to talk about include amphetamines, which act on the cerebral cortex, analeptics and caffeine, which act on the brainstem and the medulla, to trigger or stimulate respirations, and anorexiants, which are thought to suppress appetite by stimulating the satiety center and the hypothalamic and limbic regions of the brain. Long-term use of amphetamines can produce psychological dependency or tolerance, conditions in which larger and larger doses of drug are needed to reproduce the initial response. These medications are usually prescribed for short-term use, up to 12 weeks. Attention deficit hyperactivity disorder, or ADHD, is thought to be caused by the dysregulation of the transmitters serotonin, norepinephrine, and dopamine. ADHD usually occurs in children before the age of 7 and is more likely to occur in boys. Characteristics of ADHD includes inattentiveness, inability to concentrate, restlessness or the child being fidgety, hyperactivity, excessive or purposeless activity, inability to complete tasks, and impulsivity. It is important to note that intelligence is usually not affected, but learning disabilities often present in the patient with ADHD. Narcolepsy is characterized by falling asleep during normal waking activities, such as driving a car or talking with someone. Your slide here says recurrent attacks of drowsiness or sleep during normal waking activities, driving, talking, eating, standing. Sleep paralysis, the condition of muscle paralysis that normally occurs during sleep, usually accompanies narcolepsy and affects the voluntary muscles. The narcoleptic is unable to move and may collapse. Amphetamines stimulate the release of the neurotransmitters norepinephrine and dopamine from the brain and sympathetic nervous systems and inhibit the reuptake of these neurotransmitters. So there's more of these transmitters, norepinephrine and dopamine, available to act on receptors. Amphetamines you might hear at times also called uppers. So when you're trying to remember what an amphetamine does, if you can remember that it is an upper, it will help you remember how it affects the body. Side effects that might be seen include tachycardia, palpitations, hypertension, right? Seem to go along with uppers, restlessness, irritability, euphoria, blurred vision because of how it affects the pupils, tremors, anorexia, weight loss, constipation, erectile dysfunction, and then excessive use can actually lead to psychosis. Again, amphetamines have a high potential for abuse, tolerance, and dependence. Your prototype amphetamine-like drug, your amphetamine-like CNS stimulant, is methylphenidate. That's the medication that you'll want to know as your prototype amphetamine-like CNS stimulant. Methylphenidate, classified as an amphetamine-like drug, is given to increase a child's attention span and cognitive performance for the child suffering from ADHD. It can also be given to treat narcolepsy. So when given to the child with ADHD, we would hope to see decreased impulsiveness, hyperactivity, and restlessness. And when given to the patient with narcolepsy, we would expect to see the patient awake during normal wakeful periods of the day. Because of the potential for abuse of methylphenidate is classified as a controlled substance Schedule II drug. When teaching a patient about when to take an amphetamine or amphetamine-like drugs such as methylphenidate, we want to make sure that we instruct the patient that they should not be taken in the evening or before bedtime. Again, these are considered uppers, right? So we wouldn't want to take an upper before bedtime because it may result in insomnia. One trick to help remember what methylphenidate does, if you can remember the rhyme, methylphenidate helps the student concentrate and stay awake. So the first part, methylphenidate helps the student concentrate, relates back to the treatment of ADHD. Stay awake relates back to methylphenidate being used to treat narcolepsy. If you look under the dosage on your prototype drug chart on 227, you can see there that methylphenidate is usually administered before breakfast and lunch. So for, again, teaching on how to take the medication properly, methylphenidate should be taken twice a day before breakfast and lunch. It should be given 30 to 45 minutes before meals. And methylphenidate should be given 6 or more hours before sleep, again, because it can cause insomnia. In addition to recognizing that methylphenidate is used to treat narcolepsy, your other prototype type drug that we want to know is being used to treat narcolepsy is modafinil, taken in the morning in order to treat narcolepsy. Under uses here, both drugs, methylphenidate and modafinil, increase wakefulness in patients with sleep disorders. This next slide goes over methylphenidate again. It works by modulating the serotonergic pathways by affecting changes in dopamine transport. Again, used for ADHD, narcolepsy, interactions. Caffeine may increase effects. Sort of makes sense, right? If we're talking about methylphenidate being an upper, an amphetamine-like drug, that caffeine would increase its effects. It increases the effects of oral anticoagulants, some ones that we're sort of focusing on now at the beginning of pharmacology. The patient would have decreased effects of hypertensives while taking this amphetamine-like drug, and it also may alter insulin effects. Side effects, we talked about a little bit already. I'm going to let you look through those on your own. Again, they sort of make sense when you think about what an upper might do to the body, and those side effects can really make sense. Go ahead and look at the nursing process box on 229, pause the video, and pull out what you think is most important from that purple nursing process box in terms of methylphenidate. So looking at the nursing process box for methylphenidate, before we go on, I guess if you had to guess on what we've described, what methylphenidate is, if you had to think of the brand name, which is kind of a common brand name, just take a minute, try to think what brand name this drug might be based on what we've said. And if you are guessing Ritalin, that's the correct brand name for methylphenidate. And again, we test with the generic names, but if that knowing the brand name and being able to associate that helps you, I want to make sure that you know that. So under assessment, we want to get a good history, get vital signs, assess mental status, mood, aggressiveness, effect. A big important thing with methylphenidate is to evaluate height, weight, and growth of children. If you look at the prototype box on 228 under adverse reactions, growth suppression and transient weight loss can occur with methylphenidate. So we want to make sure that children are continuing to grow properly and aren't losing weight while taking the medication. Under planning, sort of what we expect to see with the treatment of methylphenidate, hyperactivity being decreased, attention span being increased. We expect blood pressure and heart rate to be within normal limits. Patient will behave in a calm manner. Again, if the patient's taking it for narcolepsy, we expect them to stay awake during wakeful periods. Under nursing interventions, monitor vital signs and report any irregularities. Again, it says, evaluate height, weight, and growth. That's really important that you remember that with methylphenidate. Observe patients for withdrawal symptoms such as nausea, vomiting, weakness, and headache. Monitor for side effects, insomnia, restlessness, nervousness, tremors, irritability, tachycardia, and elevated blood pressure. And again, if you're thinking of this as an amphetamine-like drug, an upper, those side effects do make sense. Under patient teaching, teach the patient to take the drug before meals. We're saying 2 doses before breakfast and lunch, and that's 30 to 45 minutes before a meal, and given 6 hours or more before sleep. Advise patients to avoid alcohol. If they do experience the side effect of dry mouth, they can use sugarless gum to treat that. Teach the patients to monitor weight twice weekly and report any weight loss. Advise the patient to avoid driving and using hazardous equipment when experiencing tremors, nervousness, or increased heart rate. Teach the patient not to abruptly discontinue the drug. The dose must be tapered to avoid withdrawal syndromes. Encourage patients to read labels of over-the-counter products because they may contain caffeine. And again, we do not want the patient mixing methylphenidate with any other CNS stimulant, including caffeine. Looking through here, diet. Under diet, advise patients to avoid foods that contain caffeine, coffee, tea, chocolate, soft drinks, energy drinks. Encourage parents to provide children with nutritious breakfast because the drug may have anorexic effects. Make sure that the patients and the caregivers know about the side effects and that they need to report tachycardia or palpitations if experienced. Under evaluation, we're going to look for the effectiveness of the drug by monitoring the level of hyperactivity, looking for any adverse effects, monitoring height, weight, and growth, sleep patterns, and mental status. Next classification we're going to talk about are anorexiants. So if you think of anorexia, it can help you remember what anorexiants do. They cause stimulant effect on the hypothalamic and limbic areas of the brain to suppress appetite. So anorexiants suppress appetite. With any sort of weight loss attempts, emphasis should be placed on a nutritious diet, exercise, and behavior modification, though some patients will need medications along with that. Children under the age of 12 should not be given anorexiants. They should focus on healthy lifestyle changes. If you look at your purple list of medications, your purple box of medications on 230, the two medications that you want to be able to recognize as anorexiants include diethopropion and phentermine. Diethopropion, it helps if you look at the first four letters, actually have the word diet in it, so that can be a reminder of what classification diethopropion is, that it's an anorexic. And then phentermine, I don't have a tip for that one. You're just going to have to be able to recognize that one as an anorexic also. Finally, we're going to get to analeptics. So when you think of analeptics, you need to recognize that they stimulate respiration. So when you see analeptic, you have to think of that medication as being a medication that will stimulate respirations. Let's see what we have here. We have listed here caffeine and theophylline as two medications that you need to know, and doxapram. Those are the three that I want you to be able to recognize as analeptics: caffeine, theophylline, and diazepam. Theophylline belongs to the classification of xanthines. Trying to think. They do have a narrow therapeutic range. That's not in this section of the textbook, but I still want you to remember it's 5 to 15 micrograms per milliliter is the desired therapeutic range for theophylline. Toxicity would occur at greater than 20 micrograms per milliliter in an adult. Newborns experiencing respiratory distress often receive caffeine as a medication that's used to help increase their respirations. So it's important to recognize the use of caffeine as an analeptic and to be able to teach a parent or a caregiver who might say, I don't understand why you're giving caffeine to my new baby when they associate it with energy drinks and things of that sort, but that it does serve a role with increasing respirations. Theophylline works by relaxing the bronchioles. They also increase respirations. It also increases respirations in newborns also. And then finally, doxapram is used most for post-anesthesia respiratory depression. So to reverse respiratory depression that's been caused by anesthesia. Side effects from caffeine include nervousness, restlessness, tremors, twitching, palpitations, and insomnia. Can also include diuresis, GI irritation. Excess caffeine affects the CNS and heart and can cause dysrhythmias and convulsions. High doses of caffeine in coffee, chocolate, or cold relief medications can cause psychological dependencies. So let's look at our end of the chapter questions. For number 1, the correct answer is A. For number 2, the correct answer is D. 3, correct answer is D. 4, correct answer is B. 5, correct answer is D.